Did you know that some commonly used medications could increase your risk of developing dementia and memory problems? While these drugs are effective in treating various conditions, their prolonged use can have negative effects on the brain. It's not about being alarmed, but about being informed. In this video, we'll tell you about these 9 medications, how they affect cognitive function, and what alternatives exist to protect your memory. Stay until the end and discover how to take care of your brain health without sacrificing your overall well-being. Number 1. Benzodiazepines. Benzodiazepines, like alprazolam, diazepam, and lorazepam, are commonly prescribed to treat anxiety and sleeplessness. While they offer immediate relief, long-term use can be harmful to your memory. These substances work by slowing down the central nervous system and affecting essential neurotransmitters like GABA. Over time, this effect slows down brain function and contributes to significant cognitive decline. A French study found that people who took benzodiazepines for more than 6 months had a 60% higher risk of developing Alzheimer's. The most common symptoms include difficulty concentrating, episodes of confusion, and short-term memory problems. Additionally, benzodiazepines cause physical and emotional dependence, making it difficult to reduce or stop their use without medical supervision. If you are using benzodiazepines, it is essential not to stop them abruptly, as this could cause serious withdrawal symptoms. Talk to your doctor about safer options, such as cognitive behavioral therapy, relaxation techniques, and lifestyle changes. These alternatives are not only effective in reducing stress and insomnia, but they also protect cognitive function in the long term. Your brain deserves attention and care. Okay, let's talk about omeprazole and other proton pump inhibitors. Omeprazole and other proton pump inhibitors, like pantoprazole, are widely used to treat heartburn and acid reflux. While they're effective in relieving digestive symptoms, studies have linked their long-term use to an increased risk of dementia. This happens because proton pump inhibitors can make it harder for your body to absorb vitamin B12, a nutrient that's super important for brain health. Not getting enough vitamin B12 can lead to things like mental fatigue, memory loss, and confusion. Plus, research suggests that proton pump inhibitors mess with the good bacteria in our gut, which can negatively impact the connection between our gut and brain. One study with 6,000 people found that those who took omeprazole for more than 3 years had a higher chance of having cognitive problems compared to those who didn't use it. Now, this doesn't mean you should stop taking omeprazole cold turkey. Doing so without your doctor's okay can make your stomach problems worse. The best thing to do is talk to your doctor. They can help you figure out if you still need this medication and explore other options like changing your diet, avoiding foods that bother your stomach, and finding ways to stress less. Small lifestyle changes can go a long way in managing heartburn without putting your brain health at risk. Number 3. Anticholinergic medications. Anticholinergic medications are used to treat many different conditions like allergies, depression, and urinary incontinence. However, these drugs directly affect acetylcholine, a key neurotransmitter for memory and learning. By blocking acetylcholine, anticholinergics reduce the brain's ability to transmit information, which affects cognitive function. A study from the University of Washington, which followed over 3,500 older adults for 10 years, found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. Some of the most common medications in this category are first-generation antihistamines like diphenhydramine and tricyclic antidepressants like amitriptyline. If you're taking these types of medications, talk to your doctor to look for safer options. In the case of antihistamines, there are second-generation alternatives such as loratadine that have fewer effects on cognitive function. Protecting your memory doesn't mean abandoning essential treatments, but finding more balanced and safer solutions for your brain. Number 4. Corticosteroids like prednisone and dexamethasone are medications used to treat inflammation in conditions like asthma, arthritis, and autoimmune diseases. Although they're effective in controlling these problems, their prolonged use can have a negative impact on brain health. This happens because corticosteroids alter the levels of cortisol, a stress hormone that, in excess, can damage the hippocampus, the region of the brain responsible for memory. Research has shown that people taking corticosteroids for years have a higher risk of developing symptoms of confusion, disorientation, and memory problems. In a British study, an association was found between prolonged use of corticosteroids and a significant increase in the risk of dementia. The effects are more serious when taken in high doses and without medical supervision. It's important not to stop corticosteroids abruptly, as this can have serious consequences for your health. Talk to your doctor to evaluate alternatives and consider treatments that reduce inflammation without affecting your brain. Options like physical therapy, an anti-inflammatory diet, and other natural treatments can complement your healthcare without compromising your memory. Number 5, statins like simvastatin and atorvastatin are medications prescribed to lower cholesterol and prevent heart disease. While they are effective in protecting the heart, some studies suggest a possible link between long-term statin use and thinking problems, such as memory loss and confusion. Cholesterol is essential for the brain because it helps form synapses, which are connections that allow brain cells to communicate. When cholesterol levels in the brain get too low, it can have negative effects on memory. One study found that some people taking statins long-term reported difficulty remembering names, directions, and recent events. It's important to clarify that statins have proven benefits for the heart, and in many cases, their use is essential. If you are taking statins and notice any thinking problems, don't stop taking them without talking to your doctor. Adjusting the dose, switching to a different statin, or adopting healthy habits, like a balanced diet and regular exercise, can help you take care of your heart and your brain at the same time. Number 6. Tricyclic antidepressants like amitriptyline and nortriptyline were some of the first medicines made to treat depression. They work well, but using them for a long time can cause bad side effects, like problems with thinking and memory loss. This happens because they block a chemical in your brain called acetylcholine, which is super important for learning and remembering things. Studies show that older people who take tricyclic antidepressants have a higher chance of getting dementia compared to those who don't. The symptoms include trouble concentrating, feeling confused, and slowly getting worse at remembering things. Today, there are safer options available, like medicines called serotonin reuptake inhibitors, or SSRIs, that don't have as many bad effects on memory. Examples include fluoxetine and sertraline, which are good at treating depression without messing with how you think. If you're taking tricyclic antidepressants, talk to your doctor about maybe switching to a newer, safer treatment. Number 7. Amphetamines are medications mainly used to treat attention deficit hyperactivity disorder, also known as ADHD. They're also used to treat narcolepsy. Common examples include methylphenidate and brand names like Adderall. These substances work by stimulating the central nervous system, increasing the levels of neurotransmitters like dopamine and norepinephrine. Although they are very effective in the short term, prolonged use can have serious adverse effects on the brain. Studies have shown that prolonged and unsupervised use of amphetamines can cause damage to neuronal structures, affecting memory and concentration. In addition, their continuous use can cause physical and emotional dependence, worsening the problem in the long run. In some cases, people who abuse these substances experience symptoms of cognitive impairment, irritability, insomnia, and emotional problems. A recent study found that individuals exposed to high doses of amphetamines for years showed signs of premature brain aging with an increased risk of developing dementia. The recommendation is clear. If you take amphetamines as part of a treatment, make sure that their use is strictly supervised by a doctor. Also, explore non-pharmacological approaches for managing ADHD, such as behavioral therapy, organizational techniques, and lifestyle changes. Your brain needs balance to function well over time. Number 8. First-generation antihistamines like diphenhydramine and chlorpheniramine are medicines used to treat allergies, colds, and sleeping problems. Even though they're good at relieving symptoms like itching, congestion, and a runny nose, using them for a long time can have bad effects on the brain. This is because of their strong anticholinergic effect. By blocking acetylcholine, these medicines mess with how information travels in the brain, which directly affects memory and concentration. A study in the JAMA Internal Medicine Journal found that older people who regularly took first-generation antihistamines had a much higher risk of developing dementia. The effects can show up as frequent forgetfulness, trouble focusing, and mental confusion. This is especially worrying because you can buy many of these medicines without a prescription, which makes it easy to use them too much. The good news is that there are safer choices. Second-generation antihistamines like loratadine and cetirizine give you relief from allergy symptoms without causing those anticholinergic effects. If you use antihistamines a lot, talk to your doctor to figure out the best option for you. Also, doing things around your home to reduce dust or dust mites can help you manage allergies more naturally without affecting your brain health. Number 9. Opioid painkillers like morphine, codeine, and tramadol are strong medicines used to treat severe or long-term pain. While they're good at relieving pain, using them for a long time can have serious effects on your body and brain. These drugs work by attaching to opioid receptors in your nervous system, which blocks pain signals, but it also slows down brain function and can affect your memory. Many studies have linked long-term opioid use to a higher risk of cognitive decline and dementia. This is because opioids can reduce blood flow to the brain, mess with how neurotransmitters work, and damage the connections between neurons. Symptoms include memory problems, trouble concentrating, and feeling generally confused. Plus, these medications are very addictive, which makes long-term use even riskier. If you're taking opioid painkillers to manage pain, it's crucial to do so under a doctor's close supervision. There are safer alternatives for managing chronic pain like physical therapy, relaxation techniques, exercise, and complementary therapies. Never stop taking opioids suddenly, as this can cause severe withdrawal symptoms. Talk to your doctor to find a comprehensive approach that takes care of your body and protects your brain health. We've talked about 9 medications that may be linked to a higher risk of dementia when used long-term. Benzodiazepines, Omeprazole, anticholinergics, Corticosteroids, Statins, Tricyclic antidepressants, Amphetamines, first-generation antihistamines, and opioid painkillers. The key is to never leave treatments unsupervised by your doctor. Talk to your doctor, assess the risks, and look for safer alternatives. Also, adopting healthy habits like a balanced diet, exercise, and relaxation techniques can make a difference in protecting your memory. If you found this video helpful, give it a thumbs up, subscribe, and turn on notifications. Your brain is your most valuable resource. Take care of it responsibly and attentively. See you in the next video.